People tell us every week that our information has helped save their life. If you agree that this is helpful information, please like, share, and most of all, subscribe, because nothing makes a channel like subscriptions.
Bobby Ocampo, the problem with the endocrinologist guidelines want us to maintain diabetic. They say that maintaining a 7% hemoglobin A1C is enough. Something is really wrong with the guidelines. Bobby's got a really good point. Bobby, I think, is a healthcare provider in the Philippines, and sure enough, it's a weird group, and our group is considered weird within the medical channels in terms of managing diabetes, because we think 7 is just really bad. I've got tons of diabetics in our practice, and people that when you challenge them, their blood sugars go up to 300, 350, 400. Significant diabetes. I had a very young man come to us once who had, a year before seeing us, he had just totally rebelled against his diabetes care, felt like, I'm a young person, this shouldn't happen to me, I'm going to ignore it. A1C got up to 14. He ended up having some very serious problems, required skin grafting and hospitalization. But the bottom line is, even the AACE, the American Association of Clinical Endocrinology Standards Committees, often recommend this level. And one of the reasons why is the previous medications that these levels were based on. If you got lower than an A1C of 7, and especially for the older diabetics in the 70s and 80s, to use the medications like insulin to get that low, you ran danger of hypoglycemia and death associated with hypoglycemia. Well, I would say using insulin, eating a ton of carbs, and using insulin to manage your diabetes is it's incredibly old school, it's incredibly dangerous, and that is what led to these standards committees recommending an A1C of 7.0. Like I said, I've got patients with very significant diabetes, many of whom control their A1Cs down into the 5s and even below, doing it with lifestyle alone. Now, I don't really recommend that. I think metformin and the new diabetes drugs that we talked about, the GLP-1s and the SGLT2s, and even before that, pioglitazone, the thiazide diazides, those which are getting passé at this point because of the risk benefit. But even those were big helps to people that had very significant diabetes.